So, good morning, everybody, and welcome to the Waking Up series on the Rise on mental health in young adults. We are really grateful to have with us today Dr. Cara Reader, Daisy Anspach, and OConnell Case. We'll give them the chance to be able to introduce themselves. Before we do so, I want to be able to give a shout out to our sponsors, the Greater Bloomington Chamber of Commerce, as well as the Bloomington Board of Realtors. We appreciate them being here for their support. This event is being recorded. This time we are doing this, as I mentioned earlier, as we were coming in, we are doing this through a Zoom meeting format rather than the webinar format. If you have questions, you can be able to signify by raising your hand, preferably using the Zoom feature, but I'll try to keep a mind out. You can also post questions through the chat. We'll do the best that we can in terms of getting to all the questions that we possibly can. Want to just start by thanking everyone for being here on this Thursday morning, fall Thursday morning, to again say that I am Mark Fraley. I'm the Associate Director of PACE, the Political and Civic Engagement Program at Indiana University. We are proud to help support the United Way speaker series, the United Way Wake Up speaker series. And I know we've got a lot of our friends with United Way here with us today, and so we really appreciate their support in being able to pull off all of these incredibly important discussions that we're having with different folks from our community. So with that said, I am going to now allow our panelists to introduce themselves, and I will start with Cara.
Hey everyone, good morning. I'm Cara Reader. I'm from ivytech Bloomington. I'm the Director of Student Success and Retention, and so my office oversees most things related to mental health. So we are also the Office of Disability Support for students who fall under the ADA and need accommodations. I oversee our wraparound efforts, which is supporting students with whatever type of needs they may have, from mental health to transportation to food. And then I also am the Deputy Title IX Coordinator for our campus, which means I interact with students who've experienced sexual assault, maybe having some conduct issues. And so my office is really about supporting our students who need it. And our focus is student-centered and student-driven. So we let the students tell us what they need, and really everything we do is to support them. And we often know that we need to support them in ways that is not academic. So they may need help with food before we can expect them to do well on their anatomy test. So we do make a lot of referrals out to the community, but we are very student-centered and driven. So thank you for having me.
Excellent. Thank you so much, Cara. Daisy.
Hi, everyone. Thanks for having me here. It's really nice to meet everyone. My name is Daisy Anspach. I am a social worker and work at CAPS, which is the Counseling and Psychological Services Department on IU's campus. We provide emotional support for students. We're a team of psychiatrists, social workers, counselors, and psychologists, and we provide individual counseling, group counseling. We have various support groups and also emergency services as well. Any member of the IU community can also contact us if they need support for kind of helping a student or any member of the IU community as well. As a clinician, I'm trained in cognitive behavioral therapy, dialectical behavioral therapy, motivational interviewing, trauma-informed care, and also I kind of based my clinical lens in antidepressive lens, which I was trained in kind of taking components of greater communities and other impacts on individuals' lives. Thanks for having me here.
Yeah, fantastic, Daisy. Thank you so much. OConnell.
Hi, I am the clinical director at Catholic Charities Bloomington, and we're a mental health clinic agency, community-based, that treats all people. You don't have to be Catholic to go to Catholic Charities. Our mission is to increase access to mental health care. And if people who have had to access mental health care, it is not easy. There are all kinds of barriers. So we look for those barriers and we look for gaps in treatment because we believe everyone deserves quality mental health care. So we'll look at things like financial. If you have insurance, but it's a large deductible, then it's like not having insurance. If you don't have insurance, then we have a sliding fee scale. And if you have an insurance that there are no providers, then or not enough providers like Medicaid, we have a large Medicaid population. Another barrier is transportation. Well, with telehealth, we may have eliminated some of that. The other is the lack of services and things like trauma, for particularly in certain populations like Medicaid, so or young children. So we actively look for the gap and try to fill that. Let's see, what else? Maybe that's enough for now.
Well, excellent. Well, thank you so much to all of you for being here. It's a really impressive panel that we have with us today. We're really glad to be able to talk about these really important issues with us. So one of the things that a lot of you touched on in just in your intros was this ability about access, so, Carrie, you mentioned at the very beginning, even things like accessing a decent education sometimes is going to depend on having certain other needs met before you can even do this. And this is something that we can't even necessarily consider. And having the even mental health needs met is sometimes very difficult as well, because, as OConnell mentioned, there's certain barriers to that. So what do you see as some of the biggest barriers to, particularly to mental health services among young people right now? And so any one of you who wants to kind of get started on that.
I would say at Tech Bloomington, a lot of our students have life circumstances that are challenging on its own. And so they are full-time parents, full-time employees. And so when they do have mental health concerns or other concerns that impact mental health, we often have to address all the other issues as well. So it seems easy to refer a student to counseling, and we partner with CAPS and Catholic Charities. So that seems easy, but if they don't have transportation or they don't have the money to put gas in their car. So it's often thinking about the 10 steps beforehand to getting to counseling and therapy. So for me, I would just get in my car and drive across town to therapy. But for our students, I have to think back, maybe 20 steps of who's going to help watch your children. Do you have health insurance? Is that something we need to help you look into before you get to the counseling? So our Office of Wraparound Services is all about preparing students to get to that point where they can be open and ready for therapy and mental health services. So a lot of our work is not doing the counseling, but it's getting students to that point where they can go get counseling, because we know once they're in counseling, that's going to help them academically, socially, all other ways. But I think I take for granted a lot of times how lucky I am to have a car and just to be able to go where I want or have the money and time, where our students, that's not always the case. And so I see that our students always want to go get help and they're asking for referrals, but it's just not as simple as here's the address, go get there. So access wise, that's definitely what we see as an issue.
Mm-hmm.
One of the positive things about the pandemic is that we've all gotten very good at doing telehealth. So that has increased access. So as long as the person has the ability, has a smartphone to be able to, we can provide the services. And we didn't even know that that would be such a help. So what that means is someone who's working full time can actually take their lunch and arrange at work to get services, and transportation isn't a problem. So that part is good. It's making that phone call that is tough, and we know that. what we're finding is that, particularly with this group of late teens, early adults, we've had an increase in those. And it is, the CDC did a survey that just came out last week. I think it was like 63% of all people in this population reported increased anxiety and depression, and 25% higher suicide ideation. And so we're seeing a triple. First, we saw in August a double in our referrals, and in October it was triple. And so one of the barriers is, can you get in someplace?
I also echo aspects of how financial and like transportation can be limiting access. And one thing I've also echo that telehealth has been great in terms of like students who are, as long as they're in Indiana, we're able to meet with. One other aspect of access, I would say, I'm the embedded counselor on campus with the Asian Culture Center, and I work with a fairly large amount of international students and in various cultures, communities. Sometimes stigma of mental health can also be a barrier towards accessing services as well.
Yeah, you know, that's a very interesting point. You know, when we talk about the stigma, and sometimes it's like the stigma of mental health, you know, because in order to be able to make the point of reaching out to a counselor to begin with, you know, there has to be some sort of recognition of, you know, I could use somebody to talk to, right? You know, and so that's got to be a huge barrier. So to really talk about that cultural component is really interesting, because, you know, I remember seeking out mental health services 20 years ago, and it not being something that a lot of people talked about. Now it seems to be, at least in the context of where I'm in now, people have more of an ability to be able to talk about these types of things. But you're probably also seeing an increased demand for psychological services. And so how has that affected, you know, how has that affected the mental health community? Is the increase in demand for mental health services an indication that we have higher rates of anxiety and depression? Is it an indication that the stigma is being reduced, or are we seeing a little bit of all of these factors at play here?
I think because our referrals have increased so much, and it sort of matches the surveys, I think it has to do with pandemic, but definitely stigma. There's less stigma, that's for sure. What we're seeing is a lot of first-time people that have never sought therapy before. And to be able to make that call, you've got to be in some distress, and because it takes courage. And so what we know is that they're more urgent, where the intensity of the calls are more urgent than they've been before the pandemic.
We're definitely seeing that as well, is that our students are struggling more and with more severe issues. But before the pandemic, and it still holds true, our campus, out of all the Ivy Tech campuses, had the most students who work with our office. And so we really attribute that to the Bloomington community of helping students see it's okay to ask for help, and that the community works together to make it easy for those students. And so also, my staff, our kind of theme is, if something's happening on campus, we're going to be there to make our faces known, so that, you know, if you're talking to Cara, it's just normal. She likes to come to things and she's a part of the community, not that you have a mental health concern. And so really trying to make that stigma go away, of that, you know, we also help with student life. We help with academics, not just mental health, to make sure that students who do need us don't feel afraid to come onto campus in the mental health area. So I think we do see that, the stigma, but I think as a campus and as a community, we've worked really hard to tell our students it's okay to need help, and that most people do need help. So When I tell students we have over 600 students who use our mental health services on campus, they're usually taken aback because they're like, who else is doing that? I'm like, well, that's a lot of people on campus. And so I think we've worked really hard as a community to support our students in that way. And it's something that I'm very proud of when I get to say that, is that we have the highest amount of students who seek help out of all Ivy Tech campuses. And I think it speaks to our community.
I agree that perhaps it's a little of each area in terms of like the higher rate of seeking services right now in the context of COVID. It's there's stress from online school now within the context of IU, of course. There's stress from online school. There's the stress from COVID. There's also the aspect of like connecting with peers looks a lot different. And as human beings, connections is so important, and it's kind of what we're wired towards. So that's also, I think, making a great impact as well.
Yeah, wow, there's so much to unpack in all this, and I wish we had more than an hour to have this discussion, just because there's so many different questions that I want to really get at here. But one of the things that occurs to me, I know that a lot of you are working with the mental health, the young adult community, and particularly with students. I'm an instructor. I work with students here at Indiana University. Are there things that, and I see that some of the folks here who are in the audience are also a lot of people who work with students. And so is there something, and I know that anytime I'm in my class now, and my classes are all on Zoom, it's very telling, right? Like that the level of stress that people are going through is a whole level different than it has been in the past, right? And people are openly expressing this. And so is there something that, we as, faculty and staff, at different high schools, colleges, universities, what is it that we should be keeping in our minds when we're talking to these students? Because, there's a lot of the people who are in, who may be in my classroom, who are going to see folks like Daisy or Cara, like what is it that we should be keeping in our minds as we're interacting with students and designing our curriculum?
I think one thing that comes to mind anecdotally, I've heard of students talking about how like their professors have said like, well, since you have more free time, these are all the other assignments and readings that you can do, and just being mindful that like COVID, election, just all the things that are going on can be great stressors and impacting just daily life and functioning. Being mindful of some of those things as like the curriculum, the classes are designed.
Yeah.
I know for our students, we're often the most stable and secure place that they have. And so during the pandemic, we've seen a lot of students say, I might lose my job, things aren't stable, so-and-so is sick. And so I've really been working with our staff and instructors to make sure they're providing an environment that is safe and stable. And so this might be the one area that everything is the same in their life. But if you consistently hold office hours, or you consistently ask after class, hey, does anyone need to chat? And letting it be known that it's okay not to be okay, and that every week I'm going to ask you. So when it's your week that you're not okay, you can come talk to me. And so that's something our students always tell us, is that Ivy Tech is the one place that is stable in their life and that they know what to expect. And so I think that's hard right now for our students, because we might be virtual, we might have to, shut down campus. It's just an unknown. And so really trying to control the services that we provide to them and make it stable and always there and consistent. So that's what we hear from our students a lot.
Yeah.
Yeah, that's a really good point of having that consistency and a predictability in one area. It can be really helpful with all the unknowns and unpredictable aspects and components.
Well, and Daisy, you mentioned that, we're wired for social connection, and this is one of those things that a lot of us are being deprived of. And so I'm wondering, how much of this is playing into effect, right now, because a lot of us are living different lives. Some people are single, other people have partners and families. Some people are going to, are returning to school and already have their social connections made. Other people are freshmen who are there for the first time and haven't met anyone, and are trying to be able to form connections online. So how has that aspect of like the kind of disrupted social environment affected students' mental health? General.
Yeah, certainly we haven't, like, I don't have any exact data for it, but again, anecdotally, not having, like, again, like you said, with freshmen especially, not being able to build a community, not being able to build an area of support, it leads to like more loneliness that I've observed, and feeling like, what's like, is there something wrong with me that I can't make friends? And at the same time, kind of like expanding and acknowledging that this is a difficult time to be able to navigate and connect with folks. It is a really different time too, and coming to somewhat of an acceptance of that can be really difficult sometimes. And especially in thinking about like mental health in general, and how we're all like kind of on Zoom now, and how that's different from meeting in person. And those things can definitely feel different and be hard thing to accept.
I think one thing that kind of keeps me up at night is that if you've been to our campus before, it is pre-pandemic, very busy and happening, and that staff is in the tutoring center, in the commons, trying to just make student connections. And that a lot of times my staff and team would kind of like catch students who need that mental health support just by talking to them in the commons, or just by being around. And so that worries me that, you know, at least once or twice a week, I would get a student who's in crisis and needs help, just kind of by stumbling upon them. And I worry, where are those students now? How can we find them? And so working really hard to connect with the professors and say, you know, we kind of need you to be like our netting to catch these students that usually we would see. So that's something along with social as well that is concerning, but I think we're really trying to get there. So one of our big efforts this year is every faculty member is assigned to a couple students to kind of be like their buddy. So it's a coaching program where every single week they're going to call the student and check in. And so we know if Sarah has answered the phone and talked to us for 3 weeks, and then all of a sudden she goes missing, that's something my team can take over and go reach out. So really trying to think, how can we catch these students, how we did in the past. And I've really seen that students and professors like the one-on-one relationship and connection. So that's been very helpful. And we have found a lot of students who now feel comfortable saying, I need help, to that one person that we would have not found otherwise.
The subtle aspect of lack of social connection is that we are seeing a lot of people that had a little bit of anxiety and depression before COVID that are now not able to use distraction of social connection as a coping skill. You know, that's not going on. And so that increases the symptoms of anxiety and depression.
Yeah, no, that's a really good point. So one of the things that we're also talking about, you know, we keep hearing also a lot about things like, you know, Zoom fatigue, and a lot of us students are on meetings on Zoom classrooms and Zoom events, and those of us who are working in the world, we're constantly on Zoom, and some points just logging onto another Zoom meeting can be an added stressor. How does that affect the service delivery during this time? Is that also a barrier too? Just the fact that it's like, okay, well, I know I need to see someone, but it's also just another Zoom meeting.
Right. Well, the first part is that for therapists, being on Zoom every day all day is very tiring. I do supervision with each therapist, and what I often do that by phone just to give them a break from that. It's also, we've had to take everything that was in person and figure out how to convert it into virtual therapy. And there's a certain strain to that. I notice people, the staff are better at that. because there's a certain stress to, am I given the best care I can virtually? And we found actually some good things like being able to use Zoom Zoom is what we use for our telehealth, and we can do some interactive things with it, but it's like reinventing it.
Mm-hmm.
So yeah, people are tired at the end of the day.
We have been really trying to think of other ways to connect with our students. So while we're not providing like direct mental health support, we are referring students and checking in. And so recently we got a two-way texting system. So from my computer, I can text a student and they can text back. So that's been really great when I know my students who, have 4 kids and they have to make dinner, they can't sit and Zoom with me, but they can text back in between, someone's nap and laundry. And so that's been a really different way that students are receptive to because it feels natural and not as draining. And so even in our system, you can schedule out text. And so one student I work with every morning, she gets a text from me saying like, you can do it. It's going to be a great day. And I just schedule that out for, a month at a time. And that seems to be really something our students are liking because it feels normal in a world that right now isn't normal.
Mm-hmm. Yeah. That's a good point. So, when we're talking about screens, screens have been are increasingly a part of our lives, right? Even before COVID. And when we talk about mental health, and particularly among young adults, late teens, young adults, oftentimes we're hearing more and more articles about the effects of social media, and does that have any sorts of effects on things like loneliness and depression and anxiety? And so we'd love to hear from some of our experts here. Is this something that we're really seeing a real effect of a detrimental effect of social media on people's mental health? Is this hype? I would love to hear some of your thoughts on this.
Definitely. Part of what we talk about in coping as a coping mechanism is not to be so immersed in the news, with the election and the pandemic, and stay informed, but not immersed in it, because it becomes a bigger perspective. And social media, yes, because, they're comparing themselves with each other and they can get in debates about everything. I'm doing better. I'm a better COVID person because I won't do this and I won't do that. So definitely, I don't think it's hype. What do you guys think?
I definitely have had to have that conversation with students, especially in the beginning of the pandemic, that, I'll say something like, I can see your anxiety is increasing, and that's because you're checking the news and Twitter every 30 minutes. And so let's create just one time each day that you're going to check in so you can stay informed, but it's not overwhelming and harming you. And then really also thinking about with students that if you have to be on Zoom for class, you have to use our Canvas, which is, similar to social media. Let's carve out time where you're technology free and you're present with your family, because we know that will help you as well. So I'm definitely seeing everything OConnell is seeing. And I don't think it's just like, a myth. I think it's truly happening.
Yeah, I agree with what both have said as well. Like even I've had to like kind of reflect on my social media use, news, looking at it. And it doesn't mean that like you don't care about those things if you don't look at it, but if it's helpful to kind of have a limited time to kind of observe some of those things, what media feels more helpful to receive some of that information. And along the comparisons aspect, social media is a great place of that, of kind of like, well, they all look like they're hanging out with people, I feel like I'm alone. And at the same time, social media is that like space in which people are portraying a life that they want others to see, but that ends up being what we're comparing ourselves to, and that can be something that's quite impactful.
Yeah. No, I think that's I think that's a good point. We got a comment that social media is better when we just share cat videos. Well, yeah, I could definitely see that. You know, at PACE, you know, so we help orchestrate a lot of the election related stuff, a lot of the voter registration, voter engagement stuff, and we've had these national calls about what different universities are doing in order to be able to help students maintain mental health. And one of our collaborative partners, which I haven't thought of before, because they had to leave early, just like our students did, and students were disappointed that they didn't get their play puppies, like the stress puppies during exam week. They had them out during election week, and it was like, oh my God, I wish I would have thought of that like sooner. But since we're talking, a lot of you have mentioned the elections and the political situation. We're in a very bizarre political situation, it seems. I mean, maybe at every time in history we look at the political situation, it seems bizarre, but over the past year, not only have we had the pandemic, but you have seen more attention to cases of police brutality and systemic racism. You have seen forest fires that you can see here from Bloomington, right? And you see event after event after event where it just seems suffocating sometimes. And is this contributing to the mental health issues that we're seeing among young adults today?
In a sense, because it feels like the world's out of control, that there's no safety and security, and I think it feeds into that.
I know with election coverage and spending time in the news, I was talking to a student club a couple of Fridays ago, and we realized as a group that they think through social media and following up on the election and police brutality that they are connected, but really they're not making those strong connections that you would make with a friend. And so you may look at your Twitter and see I have 600 friends, but that's not true connection. And so the club I was speaking to, we really focused on how can you truly connect to stand up for what you believe in and what you want to fight for, but not in a way that's exhausting every day, because you can't make progress if you're exhausted. And so I know a lot of our clubs have spent a lot of time of just having open Zooms where students can come in and share what they're feeling, and that there's staff and faculty on the Zooms who are informed in that area that they might be talking about. So we definitely have seen it, and students have told us, this is hard to be living in a pandemic with election results and still having to do everything else. And so I asked them, what could instructors and staff do? And they said, just understand that things are hard right now. So whenever I'm working with students, I try to say, I understand right now, this is a really hard time for you. What can I do to support you? And usually just by saying that, they're like, thank you. That's all I needed to hear, to know, because they see us as just like really smart people who have all of our stuff together, and they don't recognize that it's okay to struggle.
Yeah, I think like in this time, it's hard for students, it's hard for instructors, it's hard for kind of just everyone right now, and can be a sense almost, and if we take the lens of like it being kind of a community trauma, we're living through it, and it can be important, again, just for having a listening ear, and at a time where it feels like harder to do that. Where are the aspects, where are the places, where are the spaces in which connection is happening, in which you're able to kind of also engage with the values that you have throughout this time, which again can be harder.
Yeah. I'd love to hear from folks who are who've been listening to the panel today. If there are questions or additional comments to feed the conversation, feel free to indicate through like the Zoom feature. I'll try to. You can raise your hands here as well. But are there questions from folks in the audience so far? Iris, is that a hand up? No.
I have a question.
Go for it.
So hi, my name's Catherine. I finished undergrad in May, so that was a fun time to get a degree. And I struggled very much to find a full-time job. And I was really lucky to have the resources to go on to grad school instead of settling for a job outside of my degree field. And so it seems like anybody at any age making serious life or career choices right now during a pandemic, it's a very unique situation, and college students are making those decisions all the time, and young adults. And so I was wondering, in your guys' experience, did you deal with a lot of like life and career stress, and how has the pandemic affected it?
What we're seeing is a lot of transitional issues. I mean, it's normal to have them with this population. The difference is a lot of kids or young adults who had a plan are now questioning their plan. You know, and it may have nothing to do with their circumstances as far as resources and all that. They just have less confidence in their choices. They're questioning all their choices. Spending time alone a lot of times is one of the reasons. They're a lot of times in their head, but the world is less predictable to them now. And it probably always was, but we felt like it was more predictable. And so there's lots of questions about the choices they've made, and with careers or going to school or staying in school. And I'm sure Cara and Daisy hear about this all the time. But those transitional questions are bringing a lot of the young adults in for services.
At Ivy Tech, we've been lucky that the state of Indiana is helping Hoosiers who've lost their job due to the pandemic come back to school. And so when working with these students, I've really seen they've been through traumatic experiences the past couple 8 to 9 months. So losing a job where they no longer can support their family. And so really when working with these students, thinking about that of, you know, their life has been totally changed in the past couple months, and that's traumatic to think we might be homeless because I lost my family or lost my job. So really when working with those students, we've tried to talk about what can this degree, you know, get you in the future, of how much stability might this bring, and that we recognize you've been through trauma, and what can we do to make it feel like this is a safe place for you to learn, because we're excited to have you, but recognize that what you went through was very scary and life-changing.
Yeah. And so I want to get to Kay in a second, but I also wanted to mention we've got a question in the chat that I really want to draw attention to, because this is someone who's sharing their own experience, saying, I was an undergraduate attending at IU with serious mental health, serious mental illness, and now I'm a returning student and professional staff member still living with serious mental illness. While I did engage with the student support resources available to me as a young undergrad, and again when I returned, I found that to continue my studies, I have to jump through continuous administrative hoops just to continue my coursework. The burden is overwhelming, and I've considered engaging in studies elsewhere as a result, and I'm not alone. Dr. Reader just said that you can't make progress when you're exhausted, and that is certainly true of my progress. But it was the lack of empathy from staff and administrative barriers that majorly contributed to that exhaustion. Do you see anyone reviewing the administrative barriers facing students with psychological disabilities?
Yeah, that's a really difficult question in terms of like CAPS being within a greater university. And so let's say it's like really hard to go through some of those administration steps and barriers at times. And kind of, I don't know if I have best answer for that, but being able to, I know like we try as much as possible to kind of work with students along what they're needing with school and with mental health. That can be a really difficult thing to navigate while school is going on, while like we might need a break and classes don't necessarily have that break or that gap. And so, yeah, I don't know if I have a best answer for this, but trying as much as possible to be able to collaborate with administration. And I suppose that's not just when something's happened, but we're trying to build relationships like before anything happens. So we have relationships with like different departments along campus, with student advocates office and those different departments, to be able to try and navigate those maybe structural policies that are in place in a way that can help the student the most. And I will acknowledge that sometimes that doesn't feel as helpful in the moment or as timely as possible. And that's kind of the balance that is definitely a struggle. And thank you for the question.
Sometimes, someone mentioned that professors often will say, well, you have all this time now to work. But the thing is depression and anxiety affects us cognitive in our brain and how it works. And so it makes us more cloudy. It makes us harder to focus. And I think sometimes the instructors don't know that. So maybe a little bit more education on that would be helpful for the students.
I think one of the best things about Ivy Tech Bloomington is that the administration really listens to my team and the voice we have when working with students of different backgrounds and disability status. And so there's never been a time where I have raised a concern that it wasn't immediately addressed. And so I think that the culture of everyone belongs on our campus holds true. And so one thing my team and I do to make sure that there's no concerns out there that we haven't heard is that every 2 or 3 weeks, we'll send out a pulse check to our students who use our services and just say, do you need help with transportation? Do you need help with mental health? What's going on campus? Is there anything we can do to help you? And a lot of times that brings about concerns that we didn't know about because they feel more comfortable telling, a survey than they do coming to us. And so if we do get something that is concerning, it will be addressed right away. The student will have a response. And I saw like in the chat where it said someone submitted, a concern and never heard a response. I promise at Ivy Tech that is not something that we allow to happen, that if you tell us you're concerned about something, we will listen. We can't guarantee that, we'll give you the exact solution that, but we're going to work to make sure you have an accessible education. So I think that, again, how I said our campus has the highest number of students who are registered with disability support services shows the culture of we truly believe students with disabilities need an accessible education, and that that's their right. And if someone is hindering that in our community, that's not acceptable and it will be addressed right away. So I'm really thankful for an administration that listens and recognizes how powerful these students' voices are.
Yes, and thanks again for sharing that, Emily. I think that was that's such an important question. We will really appreciate you sharing your experience with us. And this is something that's good for a lot of us to know who are in the university area or any area where we're working with young adults, because part of it is a lot of us are also dealing with this. COVID's not easy on anybody right now. I think that there's very few people for whom that's true, and so I think a lot of people too are certainly having difficulty managing some of their own emotions, as well as navigating the ways of dealing with other folks. And so I think that this is so I really appreciate that question. I really appreciate the response from our panelists. Kay, did you still have a question that you'd like to?
I did, thank you. The demographic I work with are navigating extreme poverty, and when we, the kind of world got quarantined and we came back, and I was hearing that a lot. I was Zooming with clients and participants and things like that. And I was hearing that. And my question is this. So is that a clinical term? And so then I have a 2-part question. The other part of that is when I Zoom with people or, see them in the front, if they're saying to me, I'm experiencing extreme pandemic fatigue, and we are quite busy, our numbers have tripled and things like that. So I guess my real question is, when do you know it's crisis time? Because what they're doing when they're here is they're taking care of their tyranny of the moments, their need for food or cleaning and hygiene, and we have a child care. So it's a two-part question, but it's really been on my mind, and I really haven't had a chance to talk to anybody about that. So
I think when someone says having pandemic fatigue, ask a few more questions. Like, what does that mean for you? Because sometimes that's just a word, or it's a popular thing to say, but you're looking for ways that it might be interfering with their life. And when it's a crisis, it is feeling like they're stuck, they can't take care of their needs. And certainly it's really a crisis if they're having suicidal thoughts.
gotcha. Thank you.
That was really good. I see also another question from Brian that kind of goes back to the administrative angle a little bit. Says, how do we make administration and leaders aware of these issues? Leaders are struggling as well and are usually in privileged situation and therefore don't necessarily recognize the struggle. We began compassion circles at IU Health for Leaders. It has not only surfaced the struggles that leaders administrators are having, but clearly opened their eyes to how our team members are struggling. As we continue to discover these compassion circles for our leaders and administrators, it is our hope to wake up our leaders to this new world we are experiencing and this new world we're experiencing and how it affects everyone, awareness and personal reflection. Are there other ideas for helping administrators and leaders wake up, right? So how is it that we can best really kind of reflect and empathize with the struggles that people are facing?
I'd like to know who's involved with the compassion circle.
It's our chaplain and our behavioral health specialist.
I think people really get it when they can talk to the people, those that are affected. So if there's a way to cross that, have either students talk about it, or if the compassion group circle could include some students, I think that would be helpful.
One thing at ivytech that we have been doing to support our staff and administration to know about the impact of COVID has been every other Friday, I work with our faculty council to provide a training that my office thinks is appropriate based on student feedback. So recently we did a training about trauma and how that can look in the classroom, because we heard from a lot of students that professors weren't necessarily understanding, what does trauma look like? And so when the faculty attend that, we often let a student come and talk about their experiences and is open for questions, and then just really trying to fill the gap in between here's what you need to know and what you might not know, and that's okay, but now that you do, what can you do better to serve our students? And so last week we did one about behavior in the classroom. So if a student is acting out, it might not necessarily be that they just want to misbehave. That is probably a sign that something's wrong. And so how do you address that, and what's the appropriate procedure? So we really use student feedback that we hear to inform our trainings and what we address in our trainings.
I also agree that student feedback, or whoever the program is for, to kind of hear and listen to what's helpful and what would they like and need from that space is also important aspects too.
Excellent, thank you. Tara.
Hi, Brian, thank you for asking that question from someone who has an administrative perspective. One of the things that I'm with BTCC, Building a Thriving Compassionate Community, a network from the Youth Services Bureau, and we focus on prevention. And one of the things we're trying to help organizations look at is to take a moment of looking at the experience of whoever you're serving. So for me, I work with schools. So looking at a student's experience, like walk through the day of a student and try to pinpoint, and I'm looking through the lens of social emotional learning, try to pinpoint what are their experiences throughout the day from waking to going to bed. Where can school impact, whether their school is increasing the stress or school is helping alleviate the stress in their lives? And then where is school helping form connections or creating barriers to connections? And so I think most organizations can do something similar in walking, whether it's a patient or whether it's an employee or whether it's a student or whether it's a client of another sort, is to walk through their experience and start to pinpoint where are the things that can be either majorly changed or minorly tweaked that might relieve some pressure. And then another thing we're doing is we're using kind of the idea of the social ecological model of looking at all of the layers that build society, like from federal policy, state policy, community organizations, home life, and individual student experience, and seeing where can changes happen along the way. So like, are there system-wide policies that can change because of the new space that we're in? Are there individual behaviors that can change that some of the folks have mentioned? So so my thoughts are looking at it through the experience of the person you're trying to help relieve mental health issues from, and then looking at the different layering all the way from individual changes all the way to policy changes at the top.
Excellent. That's I really appreciate that. Do you have any thoughts on those, panelists?
Tara, that's a wonderful response. And that's really our idea of the wraparound program at Ivy Tech, is that we are addressing that each step of the way that may prevent a student from being successful. So one thing we heard is that our students who usually would use our computer labs on campus can't come do that anymore because they have to stay at home with their kids or just, pandemic reasons. And so we have loaner laptops that students are allowed to use as long as they're a student with us. And so that is one little thing that to us is not that big of a deal, but that helps them be able to do their homework at home and giving them the hotspot that goes with the laptop. So that's our wraparound mission, is to think about every little thing that is in between the student and success. Because a lot of times it's things we as an organization can help, in that it's not that hard for us, but to a student, $1,000 laptop is a massive deal. So really thinking about being a student, and that's one great thing about Ivy Tech, is that a lot of our students become employees, and so they have that experience of it was hard to do this step, or this program wasn't as effective. And so really listening to the students and thinking about the things in their mind that they think are a really big deal, but to us, we're like, that's not a big deal. I can go get you a hotspot.
I also appreciate that response in terms of like, we individually experience these different stressors or different aspects of our mental health, and those can be greatly connected to like the policies of school, or like if you get sick, what's health insurance looking like? What are the greater policies related to that? And so, those are also changes greater than the individual, and at the same time, really interconnected.
Excellent. Well, we only have a few minutes left, so I want to see if the panelists have any final words that they would like to be able to offer, either on the nature of the subject, something that we haven't talked before, or if there is any sort of piece of advice that you'd love to give to either someone who is struggling with mental health, or is or cares about someone who's struggling with mental health, which is probably all of us, you know. So if you have any final words that you'd love to share, and we'll do the reverse order than we started with. So OConnell.
I think the first thing is we have to take care of ourselves, otherwise we can't take care of others. And so that means, you know, taking time for yourself, getting outdoors, doing something enjoyable, staying off, not being immersed in the social media and the news. If we're here, Catholic Charities is here if there's more needed. One of the things we're getting ready to do is start a parenting program where someone can call in and schedule an appointment. So some of our young people that are parents can call in for an appointment with the therapist, not to open as a client, but be able to just have a consult on telehealth, and hope that maybe that could be a help as a boost. And I also want to say that I'm so glad that ivytech is working on the basics, because we can't help anyone if we don't have the basics done.
Thank you. Daisy?
Yeah, I would just say like in it together, but like kind of staying connected, and borrowing words from Dr. Bessel van der Kolk of being like keeping the days as predictable as possible, or adding predictability to that in times when things feel really unpredictable and unknown, and things routine may feel harder and at the same time important too.
Thank you. And Cara?
I think our overall view at Ivy Tech Bloomington is that it's a privilege to serve our students, and that we want to make sure they're supported in any way that they need. And so sometimes student success doesn't mean you have an associate's degree and you're off to a four-year school. Sometimes student success is belonging and knowing you have a place that cares for you and loves you. And so really, I encourage anyone in the community that, you know, we're here for you, whether that's you just want to take one class or you do want a different career. My team, my office, and especially just overall, we say it takes a village at Ivy Tech, and we think our village is open to everyone. And so I think a lot of people find that in the pandemic, especially, that's welcoming. And so a lot of people would say maybe this isn't the best time to start school, but we've heard otherwise from students of that this is now a place they belong and that they feel supported in. So we do that with the help of our community partners, and we really appreciate that. So we're not doing it alone. We recognize that, but the Bloomington community especially is really supportive. So thank you.
Well, thank you so much to all of our panelists, Dr. Cara Reader, Daisy Anspach, OConnell Case. If you can all give a Zoom applause to our panelists. And to thank all of you for showing up today. I think that it's actually very important to be part of this conversation and just hearing some of the things that they have to say. I know that I've certainly learned a lot, and I hope that y'all have too. Again, I want to be able to do a shout out to our sponsors with the Greater Bloomington Chamber of Commerce, as well as the Bloomington Board of Realtors, our friends at United Way. Thank you so much, and hope you have enjoyed the rest of your day. Feel free to submit comments and join us for the next United Way on December 10th, where we're going to be talking about representing workers during a pandemic. Thank you so much, and be well and take care.